Good afternoon, everyone, and welcome to the Urban Institute online and to today's discussion on building community power into decision-making. My name is Kim Leary. I'm a Senior Vice President here at the Urban Institute, and it is my great pleasure to moderate today's discussion. Before we begin, though, let's start with a few housekeeping events, most of which are probably familiar to you from many Zooms we've all been on. First of all, today is being recorded, and the recording and the relevant links will be posted online after the event. All of the attendees are muted, but we very much encourage your engagement. So please type your questions and comments into the question box at any time. We will have a few moments at the end for questions the panelists will be able to respond to. But even if we happen not to get to your particular question, I want you to know that your questions are important to the panelists, they're important to us at Urban, and they will certainly help us to shape what we do going forward. And if you'd like to be part of this discussion online and on Twitter, please use the hashtag #LiveAtUrban. So this, of course, is an incredible moment in history for us to be gathering. Last week, we witnessed the invasion of the Capitol, the center of our country's policymaking space, by a mob of insurrectionists challenging the very foundations of the rule of law. For me personally, and I imagine for many of you, to see a Confederate flag flying in the Capitol left an image seared in my mind's eye. And it was yet another trauma in a year that's been full of them. Events like these, we know, destroy trust in public life at a national scale. But trust has also been eroded and perhaps has been non-existent at local scale in many communities, particularly those that have experienced disinvestment, marginalization, and other forms of disempowerment. Communities hold incredible knowledge and capacity, but many have been historically sidelined from decision-making circles. And as many of your organizations surely do, much of our work at Urban addresses the needs of those very communities. And engaging with the needs of those communities is understood by those on this call, and we hope an ever-widening circle, as a must-have, not a nice-to-have or a box to be checked, but as a fundamental way of grappling with the ways that our research interests impact with communities and community members. So our discussion today will be guided broadly by two questions. How can we best center community knowledge and priorities in our work? And how can we bring those with lived experience and professional experience together to facilitate change? Now, one of the many ways that Urban has tried to begin to answer those questions is by working with individuals and communities who would normally be thought of in some circles as the research subjects, and instead thinking of them and working with them as collaborators and as partners in collective work. Projects that use community-engaged methods strive to ensure that those with lived experience not only have a seat at the table, but they have the power to determine the solutions to their challenges and the strategies for achieving their goals. Community-engaged methods does more for all of us as well. It enables organizations like the Urban Institute and others who are typically in positions of decision-making authority and privilege to rectify past harms caused by research and policy, whether intentional or unwitting, and to build community capacity to conduct the work themselves and to ensure its sustainability. And finally, these methods help us to improve the quality and accuracy of our work. So today, we welcome all of you and our speakers into a conversation on building community power into decision-making. And we hope that they, and possibly some of you, will be able to share some concrete examples of what community engagement looks like in practice and what it can help to achieve. So with that, it is my great pleasure to introduce our panelists. And let me start first with Pastor Gary Hill. He is the president and executive director of the Exodus Treatment Center. He is a proud DC resident, born and raised, and an avid Nationals fan. He sees the community as his church and has been on the front lines of supporting several Ward 7 and Ward 8 communities during the current health crisis and long before that, with the long-term battles related to gun violence and substance use. Pastor Hill focuses on the strengths and the potential in each person as part of the faith that moves them beyond their daily struggles. Next is Dr. Aisha Yandoro, who is the Chief Executive Officer of Springboard to Opportunities. She is a passionate advocate for her community in Jackson, Mississippi. A natural-born storyteller, she believes strongly that we must listen carefully to the narratives of individuals and communities that have long been silenced, underappreciated, or marginalized. And most recently, she has launched the Magnolia Mothers Project, an effort to provide direct cash transfers to low-income mothers to help inform and restructure the social safety net in the United States. It's a special pleasure to also introduce my urban colleague, Elsa Faulkenberger, who is the chair of the Community Engaged Methods Group at the Urban Institute. Elsa has been Ms. Faulkenberger with the Urban Institute for over 10 years and finds purpose and meaning in her work through her close partnerships with community-based organizations and in challenging the norms that exist all too often around expertise, rigor, and justice in research. And although I've mentioned my title, let me just say a few words about myself as well. I'm new to the Urban Institute. I've been here for 6 months. I'm a clinical psychologist by training and have worked at the intersection of communities and organizations and the mental health field to build capacity. So with that, I would like to open up our panel discussion. And I'd also hope that we might think of today's conversation as one that models some of the features of the work that our colleagues will describe for us. I know I'm comfortable being addressed as Kim, but I'm more than happy to address folks on the panel as you wish. Our first names comfortable for you? Yes?
Absolutely.
Okay, great. Well, that's terrific. Thank you. So all of you are leaders, and you've created opportunity for community voice and power in your work and in different ways. So I'd like to invite each of you to share a story that illustrates for us how you've done so and what you've observed as the results of your work. And whoever would like to pick up the baton first is fine.
Okay, good afternoon, everybody. And thank you, Dr. Leary, for a wonderful introduction. Again, my name is Gary, and I am one of the service providers here at the Woodland Terrace community located in Washington, D.C. I'm with Exodus Treatment Center and Exodus Homework Club. One of the things that we've been able to do just recently in terms of the pandemic is be able to shift our programming from our regular homework duties and activities that we engage the community, as well as the clinical approach that we had. And we transformed our services into a food agency, and also we transformed our services to be able to serve the residents with PPE items and encourage them with social distancing, because the mayor had, as well as many other cities, had many protocols in place with regard to the pandemic. So the Urban Institute was able even to come alongside of us and shift in the middle of the pandemic, and our doors remained open. We never really closed ever since March, and we've been able to actually grow as an agency, and then still be able to meet the needs of the residents and bring those needs to the community in terms of what their realistic needs were. And again, Urban was able to come alongside of us and really, really shift into high gear and keep a track of the data and all the reporting that we had started to do because of the pandemic. So thank you. Thank you for your question.
Whoops, I'm muted now. Thanks, Gary. Aisha, welcome. Just inviting the panelists to share a story about how you've done community engaged work and what you've observed as the results of your work.
Yeah, no, thank you so much for the question, and apologies. We are beginning the new year with issues with technology. You would have think not been in this Zoom world for the last 10 months. But my computer just said, I reject you this morning. So I'm on my phone, so apologies. But as far as our work with Springboard to Opportunities and how we go about including community voice, you know, it really is the backbone of our organization. In our tagline, we say radically resident driven. And for us, that means that every decision, every program, every service, every policy we implement as an organization really is aligned to the need, making sure that their voices are included. The entire organization itself exists because of this desire and this focus on residents and ensuring that community are included in a decision-making process. And we do that informally as well as formally. We believe in all of the research and the rigor that statisticians and research practitioners believe in, but we also believe that that can be done in as well, just by sending text messages or having group conversations. And more recently, you know, we've seen that come to play, not only, like I said, in the establishment of the organization itself over 8 years ago when we were designing what Springboard to Opportunity would be, but more recently with the establishment of the Magnolia Mothers Trust, which is our guaranteed income work. That work and how we go about implementing that model is in direct correlation with us being in relationship with residents, with them that they need, and how we should go about addressing those needs. So it's at the heart of what it is that we do. And without our community practitioners, i.e. the residents, we wouldn't exist.
Thank you so much. That's a powerful statement, that we wouldn't exist without our community partners. Terrific. Elsa.
So I would just like to take the time today to tell 2 quick stories about the first time that I actually met Pastor Hill and Dr. Yandoro, since they're the reason why we're here today. And they really are stories that I hope share the sentiment of nothing about us without us, which is often used in the community engagement work. So first time I met Dr. Yandoro was at an event in Jackson that she was co-hosting along with the Aspen Ascend Network. And what was really notably different about this event was who was there as participation and as speakers. There was really an somewhat even attempt at balancing participants to include both people who were community members, people with lived experience, along with people who were participating in a professional capacity. And what was also different was my neighbors are now deciding to drill into the wall. One of the other part that was really different was that the people who were there as community members to share their personal stories that day were really there to participate in the event, and that they were not token stories that were being shared on a single panel. It was really clear that the stories, that the requests that they were making, that the priorities that the community members were setting that day were intended to be the takeaways for the people who were there participating in their professional capacity. And just to give an example of that, there was somebody who was participating that day who was a higher level official at the Department of Health and Human Services for Mississippi. And she stood up at the end of the event and talked with real emotion in her voice and conviction about how far removed she had become in her many years in the upper levels of her agency, how far removed she had become from people who she felt represented herself and her own past story and her own community members, and how she was doing a real, as she expressed, disservice to people who were the very reason why she was doing her job. And she talked about how she was going to be able to take the words, the sentiments, and the real recommendations from the people who were there sharing their personal stories that day to change the way that she attempted to implement her programs and services, and the way that she worked with her staff to ensure that the way that people were coming to them in looking for support, that they were really respecting people's humanity and were not only providing them with a more respectful experience, but one that would ensure that the programs and services that she was giving were more effective for them, that they were doing their job properly. So that was a really powerful experience. And as for my first time meeting Pastor Hill, it was in Woodland Terrace in the community where his organization is based. And I came along with my colleague, Tia, and we were sharing our experience working in collaboration with another public housing community in DC at Benning Terrace. My purpose for being there that day was to try to convince Pastor Hill for him and the Woodland Terrace community to collaborate with the Urban Institute. And, I brought project descriptions and my proposal and my budget to try to show him my intention for transparency. And at the end of all of this conversation and all those materials I attempted to put in front of him, what really mattered and what he wanted to focus on was the fact that Urban had hired a community member as a permanent staff member at Urban with a position with benefits. And while this is just one person, and I'm not trying to pat us on the back, I'm just trying to say that this is what really spoke to Pastor Hill. And this is what opened the door to him thinking maybe this was a project worth taking a chance on, that he might be willing to work with us because he saw where our intentions were at least in the right place and heading in the right direction.
Thank you to all of three of you for your comments about this, which pick up on themes of trust and engagement, and that the working with the community is not just something that happens here and there, but it's baked into the very fabric of the engagements that you have. My own experience with this was when I was at the Obama White House working with the Council on Women and Girls. The most important meeting I had early in that tenure was with a panel of girls organized by Girls for Gender Equity. And all the adults who had wonderful ideas about what we should do, when we heard what was important to the young women, that really did challenge and change our agenda. So that's my little version of this. But Aisha, let me go to the research side of this, or what we think of as the sort of organizational research. One of the things we grapple with at Urban, as in many places, including our university colleagues, is what does it mean really to do high quality and rigorous research that addresses the real issues these communities have experienced, like disinvestment, marginalization, disempowerment? How does direct community engagement, direct engagement, improve the quality and the rigor of your work? And on those projects, when you're reading them, if you're reviewing a paper or something like that, where that's missing, what are we losing out when we don't have people with lived experience as leaders and participants?
No, yeah, thank you for that question. And, and I feel like it's really two parts with my answer. First and foremost, my question is always, well, how do we go about operationalizing rigor? What are our standards? So, our standards, the researchers with whom are our colleagues in some instances, if we are working for a research institution or in academia, or are our constituents community members. And, if I went about using the research definition of rigor, a lot of our work and a lot of our innovation, in fact, would not exist. Because when we were dreaming about the Magnolia Mothers Trust or dreaming about giving individuals cash without restrictions, researchers told us that it was not possible. And so that's the first thing. How are we going about operationalizing that? And then in part, what are we missing when it goes about what are we missing when we don't include resident voice? We really are making sure that what it is that we're doing is authentic, and we are missing making sure that what it is that we're proposing is actually what the community needs. And are we really going about addressing the community need or addressing our own individual needs? And unfortunately, in a lot of instances, when we're designing programs without that authentic voice, we're addressing our needs, and we are building into our ego what it is that we feel community members' needs are. are. And, so that's that piece. But then also in some instances, we are doing harm because as we are working to not marginalize, if we are excluding voice and excluding those with whom we are serving from the decision-making table and not allowing the voice to be heard, we are doing harm. And we also, in that instance, become a part of the silence the very people that it is that we say that we're working on behalf. So we really have to be careful when we are doing this work of community engagement and making decisions to not include community members in that process, because we go about doing harm when in so many instances I know we're trying to do good.
Thank you. That's a really critical perspective for us to remember and think about. Why are we doing what we're doing and who are we serving? Critical question. Gary, now you're driving change on the ground, but you also told us about partnering with the Urban Institute on a community-based research project. So I'd like to know from kind of your perspective, how has your experience working with urban researchers informed or changed your perspective on research?
Yes, thank you, Kim. Well, let me say just basically, we are of small grassroots organizations, and we have some wonderful spirit-led staff members that work along with us as well as volunteers. So we are not able to do all the work that we intend on doing because there are so many issues in the community, layers and layers of different issues that we try and support the community in doing. So we have gaps. And it's very important for our organization to get our story out and to have the Urban come along and assist us telling us our story has been paramount. Let me say, for an example, Urban would come in and do pre and post tests of some of the youth that we had participating in our program. And even we knew that youth were engaged in sexual activity at a young age, but Urban was able to come in and really narrow it down to tell us, for example, we've got kids in the community that at 9 years old is engaged in sex. And another quick example, we have older teens that weren't able to get the right health care that was necessary because they were also sexually active. And so we had a general idea. Urban was able to come in and give us specific details and tell us exactly how many of those youth were without the proper care. So it helped to broaden our view of the community, not just generally, but we were able to go into specific, which has helped strengthen our work, quite frankly. And I like what you said earlier, too, Kim, about the trust. And I did want to say, in building the trust with the Urban Institute, because they really are concerned about the work that they do, and we bring them in as well. And the youth are beginning to build trust with outside entities, and it helps the whole community heal. It helps everybody get healed. We recognize that we need each other. And so not only as our organization serves in the community, but Urban is also able to recognize that they are stronger with us and we're stronger with them.
That's beautiful. And it's also reminds us of the critical importance of facts, which we value so here at Urban, that having the right facts allows you to be able to figure out what needs to be done, how it can be done. But those facts are not going to be brought into conversation without a relationship of trust so that people are willing to communicate. Elsa, I know you've been at Urban talking about community engaged methods for some time, but you always make the point that community engagement and research is not new, that it has a history. Why are we talking about this now? And what do you see as the future of community engagement in more informed decision-making?
Great, yes. Indeed, it is not new, and Urban did not invent it. As I was preparing for this yesterday evening, I was just remembering and looking at some materials And remembering that Arnstein's ladder of citizen participation was created, she released it in 1969. Many of you are probably familiar with this. It's a very simple model that demonstrates the spectrum of community engagement from non-existent to true engagement that leads to empowerment. And just thinking about 1969, the midst of the civil rights movement, and she did this work while she was at HUD. And here we are 50 years later, still having a very similar conversation about why is it important? And that's why we're having this conversation, because it's taken that long to continue to make progress. You know, it's only been the past 10 years really at Urban that we've started to really build our capacity and expertise in community engagement and started to make a real concerted investment in doing more of that work. And even in fields like public health and urban planning, where we see they've been champions of community-based participatory research and engagement, even in those fields, it's really a niche and it's not common. And you can imagine that in other fields, it's almost non-existent. And when it is there, it's often misunderstood, and it is almost always undervalued, which is a really important point. Dr. Leary, at the beginning, you made some really important, powerful reflections on our current context. And 2020 and the beginning of this year have really had very few redeeming moments. But one thing that I am thankful for on a daily basis is that we are finally having, on a daily basis, extremely difficult head-on conversations about issues around racism, about exclusion. And in order to make sure that that moment is not fleeting, to make sure that we are having really authentic conversations, that we are planning to continue this work in the long term, I think that we really need to acknowledge some of our problematic histories, our privileges, and invest real time into reviewing the status quo. There's a reason why we have arrived at the point that we are in. And unless we really take the time to think about how we got here and what that status quo has led us to, I don't think we can just push forward and start to and expect progress. So when I say that, I mean, just to give a few examples, when we use the word expertise, what do we really mean in that word? Not to say that people with PhDs and elected officials don't have expertise as well, but we do not have a robust understanding and application of the rich expertise that exists at the community level. We need to question and think about both the meaning and the value that we associate with objectivity. The very notion of objectivity was created with the intention of keeping certain people out. And so if we continue to uphold that as one of our highest values, what does that mean for incorporating the community level expertise? And another one that we often see in our work is prioritizing efficiency and speed over sustainability and empowerment. This has long-term damaging effects, and it affects every one of us in our work. We are all in a hurry to do good work as fast as we can, and sometimes there can be the best of intentions, but it does have long-term damaging effects when we don't keep our eye on sustainability and empowerment as the ultimate goals. And so just one final point that I'd like to make is also, as you had posed to Dr. Yandoro before, is to remember what happens when you don't prioritize community engagement. So I think we have lots of examples of that going on right now as we live through this pandemic. We can see public school systems across the country that are not prioritizing equity. They are not speaking to their principals, to their staff, to parents to understand what they really need. And we are ending up with plans that don't functionally work for people's lives or for children. We see problematic data sets where entire populations are lumped together, and we are not able to disaggregate data in a way that's really functional for the people who are trying to implement change on the ground, for policymakers who are trying to use that data. And we see public dollars that end up being spent on programs and services that are ineffective or underutilized because we never took the time to ask the people who are going to be participants or clients how to best meet their needs in the first place. So those are some of the things that I try to remind myself of on a regular basis when I'm doing my work.
So that is a call to action or a call to multiple actions. And we thank you for that. Aisha or Gary, any response, reply? We want to make this conversational if we can. Any thoughts?
I feel like Elsa really just said a lot of significant pieces as to why this work is having a moment. My concern whenever we're having a moment is really how do we go about making that moment a movement? The need to include community voice in the equation of change did not just start with the pandemic. So how do we really move beyond this current crisis to ensure that we hold on to that momentum of recognizing the importance of voice? And when we talk about the importance of voice, the importance of all voices, not just the voices that are sometimes the loudest, or not just the voices that are sometimes easiest for us to get to. And, really giving ourselves permission to sometimes go slow in order to go fast, because in a lot of instances when we are in such a rush to push out these programs or to push out these policies and going fast, we still miss the mark. Like what Elsa was saying earlier, the inequities that we're seeing in education is in a lot of instances because we have been trying to move fast with how we respond to the education challenges within this country. But sometimes it's giving ourselves the gifts of grace, of slowing down and recognizing that with all of these tools as it relates to how do you go about really including community voice, that is a toolbox. And within that toolbox, you have a lot of different resources, and not every particular resource may work well for you. So for your population, survey may not work. You may need to do a focus group. You may need to do one-on-one interviews, but there are multiple ways in which you can challenge yourself to ensure that you are getting to that community voice that is so critical, and recognizing that sometimes just because something is hard doesn't mean it's the right thing to do. And those of us who have the privilege of working in community, I really do think it is our responsibility sometimes to do the hard thing. And if the hard thing is taking a step back to ensure that you have responses from those with whom you work with, challenge yourself to do the hard thing. At the end of the day, you will be better for it. It's work.
Yeah.
Thank
I
you
just,
so much. Yeah, Gary, please.
yeah, I just wanted to chime in just a little bit in what Elsa was saying in terms of, and thank you, Aisha, that was wonderful as well. Community empowerment. And she spoke a little bit about that. And what I have seen is that even though we characterize these communities and give them certain titles and names, marginalized, low income, poverty stricken, low educational, and the demographics and how we describe, or how the government, I'm gonna say this government describes these community, is not always factorial. Because what I have seen is that these communities have great resilience and things, and there are many individuals that in the community that have great wealth, knowledge, and power. So a lot of times we feel like we need to come in and empower and change the community where it may just need some love and some support, and to acknowledge some of the great work that has already been done. So the power is in the people, and the people make up the community, and the infrastructure of the whole city is made up of communities. So our neighborhoods, our hoods, and are made up of some very, very powerful people. It's just a matter of us getting that power out of the community to have them to many times to believe in themselves and to see that they are powerful and that God has ordained them for such a time as this. So and then just that resilience piece and community empowering this itself.
Well, let's see if we can widen our conversation by bringing in some of the questions that folks have been contributing over the last while. So I'm going to pose two questions to the group and invite whoever would like to reply to go ahead and do so. So the first question is, how do we push city leaders to truly and authentically engage community in their decision-making processes? So, kind of what's the way of engaging the leadership of cities in order to do this work? And then the second is, I think some folks are wanting to just understand a little bit more about the history of not using these methods. So a second question is, what are some examples of where researchers have used objectivity, but as a means of keeping people out? So let me put those two questions to the panel.
So I'll go with the city question, and I definitely think I'll defer to Elsa on the research question. In 2021, I'm staying in my lane, so I'll stay in my lane and let Elsa cover the research. And so, as far as going about getting city leaders to engage with this ideal of community voice and community practice, I'm in Jackson, Mississippi. So thankfully, we have city leadership that is really on board with this ideal of community voice. Our mayor calls himself the mayor of the people. In fact, when he was elected, in his campaign acceptance speech, he said, "Today I became mayor, but you are also mayor." So, it's the people's mayor. And so having really transparent opportunities for city members to engage in the larger conversations and being transparent with how city infrastructures and policies and those various pieces work. So I think it's less about, for me, making sure that city leaders and officials understand the importance of this. For me, it's always making sure that the community members understand that they have voice. And so when they are allowed a seat at the table, that they are actually really confident in being there. Because even if I offer you that seat, if you don't feel comfortable in recognizing that you have voice and that your wisdom matters and that it's just not a token seat, you still don't actually utilize your power and affect the change that we need from you. So for us, it really is about, how do we take that differently and make sure that our residents understand their wisdom? And how do we really go about changing the narrative by making sure that we're changing the narrator and empowering individuals within the community to truly be advocates, to truly understand how policies work, to truly understand their voice and how that voice can be instrumental in the changes in which they want to see. So for us, we flip that a little differently, and we always make sure that the families, the communities, the residents that we work with understand the importance that they have in influencing decision making and making sure that they are confident to allow their voices to be heard.
Elsa, do you want to take the question? Oh, go ahead, Gary, please.
Before Elsa goes to the research side, I just want to say just really quickly, and to allow the community to be in the planning process and have a seat at the table early. I find too often times that the plans have been made and then we roll it out to the community without the community being at the forefront of the decision-making process with government and any other agencies, organizations. Yeah, thank you.
So intentionality, planful, starting from the very beginning. Those are some of the messages that you're sharing with us. Elsa.
Pastor Hill just using the word seat at the table just reminded me of one of my favorite quotes by Shirley Chisholm that's, if they don't give you a seat at the table, pull up a folding chair. And I just love the sentiment and the spiciness behind that. But we really need to go to a point where people are not having to show up to meetings with their folding chairs. And so that was just coming to mind as one of my favorite quotes. About the research and objectivity, I'll keep it really short, and we do plan to share out a lot of materials after this. But by saying that researchers through training can be entirely objective, I think is really missing the mark that we're still human beings and not robots. It is not possible. You can be trained, and many of us are at Urban Institute, to try to be as objective and not subjective as possible. And yet we all come at this with our own lived experiences, with our own biases and experiences. And so I think it's just disingenuous to state that somebody with research training could possibly be objective when somebody who is living in a community and experiencing these issues for themselves cannot possibly do that same work. I think the even more problematic is just the fact that it is a hard and fast boundary that states that people who have experience, whose lives are whose lives are on the line and who are experiencing these policies, this research, cannot participate by definition because they are offering their subjectivity to this. And so if we fail to see how problematic that is, then we really need to take the time to unpack that and think about it. But we will share a number of materials afterwards to help to give concrete examples.
So about 20 years ago, when I was a clinician, we talked a lot about the neutrality of clinicians. And lo and behold, if you listen to what people say when they're engaged with clinicians, they're picking up lots of information. And when they share it with you, you can wind up having a much better clinical partnership. Let me throw out one question, and then I know Aisha wants to get in there too, but let me just throw out one final question that we'll close with, but I'll turn first to Aisha and then the closing question. So speaking of folding chairs, that's a metaphor that says we're all in the same room. And during these COVID times, we're not able to be in the same room. So what about the flexibility of these tools? As you've been engaged with community engaged methods over these last 10 months, how can it be adapted thoughtfully for inclusive remote access and participation? So that'll be our final question, but let me turn it over to Aisha first.
No, yeah, thank you for that. I wanted to go back to the piece that Elsa was talking about. And as I was just thinking about this engagement piece, because I know we're about to turn all of you all over into the community and you're going to be so engaged and showing up with your surveys and focus groups and all those things, which is exciting. But I want to make sure that I caution us to not be extractive when we're getting that information, and that we actually build into our research practices compensation and adequate compensation for the work in which you're doing. So if you're asking someone to show up for an hour-long focus group, let's not do a $10 Subway gift card. That is not in reflection of the time in which individuals are providing for that information that you're getting. So that's the other piece, the first piece I wanted to say with that. And as far as tools in this COVID time, COVID has been a lot, but it's opened us up to so much technology, and in communities in which technology may not have been the go-to, it now is. It's the norm for so many individuals. I was having conversations with some of our moms last week about some other work, and all of them now because of the fact that this is the time that we now call for. So having access to more people in real time, much quicker, is now available to us. You can do Zoom technology, you can do data dashboards, you can do group meets. There are so many different ways in which we can pivot to ensure that our research is responsive to where we are and the need to continue to still gather good information while we're also being safe.
Gary, any thoughts that you have about the tools that can be used now in this particular context that we're in, and how we might carry them forward?
Yeah, just basically a few ground rules, just in terms of just continue to listen and allow people to be validated. In other words, believe in them, whether it's a pandemic, whether we're virtual or not. Be consistent with your conversations. If you say you're going to show up, let's show up. And also just allow those small steps to build bigger relationships. I think building relationships, and we talked earlier, and I just can't get away from the trust, issue and the trust part of it. But yeah, just those things are just so very important in building relationships with individuals first, then you build relationships then the individuals will bring you into the families, and then the families will bring you into the community. So building relationships is also very important. Thank you.
Well, speaking of building relationships and showing up and being present, we could not be more appreciative than we are for the three of you joining us in this panel, and for all of you who have joined in. Thank you so much, Aisha, Gary, and Elsa, and thanks to all of you who've taken some time from no doubt very busy days to be part of this conversation, including those who were formulated some questions that we'll pass on to all of the participants. This is a journey. It is a journey that started, as Elsa mentioned, some time ago, but we thank all of you for joining in this journey as we build our learning on community engaged approaches. And we invite you to stay in dialogue with all of us, the organizations that we represent on Twitter and other social media platforms. And of course, the phone is probably okay too. But we do have some technology tools that Elsa mentioned through our webpage, which is dedicated to community engaged methods. And we will be sharing those links with you, as she mentioned, and launching other tools, project examples, podcasts down the line over the next couple of months. So please watch this space, that is the web space, for new information. So with that, thank you all. and you have our deepest appreciation for joining us today.